Thank you and welcome, everybody. And I appreciate you taking some time out of your day to attend. What we're covering today is some learning about supporting your frontline staff during the COVID-19 pandemic. And we're going to highlight much of what we have encountered across our 225 hospitals in the United States, many of them in hotspots, both back in March, April during the first phase, and also in July during the spike this summer. And we're going to walk through what we've learned and give you some hints and tips. But to get us started, the first thing I want to do is just walk through a very, very brief agenda of what we're going to cover today and talk through who we are as a company, Mobile Heartbeat, why communications is so critical during a pandemic. And no pun intended, we're going to present some novel use cases for a novel pandemic of how our own clients have taken this technology in some really unique ways to have a big impact. Close up with a couple of anecdotes from one of the early hotspots and how important this type of technology was, and then offer some Q&A as well. So with that as a background, let's get started. First of all, my name is Ron Remy. I am the CEO of Mobile Heartbeat. We are a 9-year-old provider of clinical communication and collaboration software. And it's a lot of words, and it's referred to as CC&C. But what it really is, when it's boiled down to its basics, is technology to collaborate and communicate effectively around a patient or a medical location, and to enable different forms of communication very, very quickly, not only knowing who to communicate with around a patient, but also if they are available. And this platform was built back in 2011. It's been expanded and is now on display and in use at a wide variety of facilities across the U.S. We're going to talk a few about those in a second. So although it is clinical communication and collaboration, we really do support both the clinical and the operational workers through the context that they find super relevant. And that is by integrating with all the key systems they rely on across the hospital. The EMR, EHR, the lab information system, the hospital contact directory are good examples. And we believe the value of any communication network is equal to the square of its participants. So what that means is if you only have 2 participants in a network, the value to your organization is 2 squared or 4. But if you have 1,000 participants in a network, 1,000 squared is 1,000,000. And the value, overall value of your network is absolutely astronomically high. And this is called Metcalfe's Law. And this is the foundational concept for our company and our platform. Adoption across the entire enterprise is absolutely key. So a little bit about who we work with, just an example of some of our clients here, large and small, all around the United States. And on the customer side, these diverse organizations are different by size, complexity, and location. Many of them are multi-site. Many of them are true IDNs. In terms of technology partners, we help our clients leverage their entire IT infrastructure. For example, our technology partners on the telephony side and networking side of the IT shop are Cisco, Avaya, and Aruba, for example. Nurse Call, a critical legacy system inside of a healthcare facility. We integrate with Rowland Borg, Hillrom, Westcom, Ascom, as well as others. And in terms of deploying the technology itself, this is a smartphone-based product, and we support smartphone installations in 2 modalities, what are known as shared devices. Basically, these are devices the hospital purchases and are used by multiple end users on a shift basis. Bring your own devices, otherwise known as personal devices. And this is where a staff member does not want to use a hospital-supplied phone, but prefers to use their own personal device and brings it into the facility. And we also do this on both the iOS and Android platforms. The majority of our clients have a mixed-use environment. The bulk of their devices, their smartphones, are iOS. And on the minority side, we've got Android devices as well. If we don't already integrate with a vendor, we look for new integrations as an opportunity to move our platform forward, and we're always available to help our customers lever their existing infrastructures. So I'm going to spend a little bit of time talking about the challenges in healthcare organization. And if you think about what today's communication workflow looks like, the images of this slide kind of put it in perspective. It's disjointed. It requires more people than it should. Notice the whiteboard on the right. It involves more technologies than it should. And most importantly, it takes more time than it should. And in healthcare, time is everything. Lean thinking or lean practices in healthcare are a trend that is going to continue for the foreseeable future. And any new technology you introduce into your facility has to be focused on making things happen faster and more efficiently. Contact directories. The staff directories and who is available and what do they do. They're usually out of date. Operators, notice the operator on the left is often required to connect people who might work in the same unit in the same building. Direct lines of communication may exist within the same team, but even then sometimes doing something simple as checking which nurses are assigned to a patient means running back to the nurse's station to manually check the assignments board on the right. We know there's a better way, and it's been proven across many clients around the country. So if you think about the problem in its simplest form to understand, think about the thousands of interactions you and your staff have over the course of a single shift. These interactions can be simple requests with yes or no answers, or if it's a patient-involved complex topic, they may require minutes of live discussion with people in different departments, buildings, or even campuses. A clinician may know they need to speak to a person in a particular role, but who is in that role right now? How do they know who is associated with the patients they need to discuss? In effect, who is on their team? And with Mobile Heartbeat software, we take these interactions from 15 minutes down to 15 seconds. So if you think about how we do this, the photos on the right show how. We have an enterprise-wide directory. The directory includes context, basically the patients, to help determine who to engage in, who's in different roles, specialties, who are involved in patient assignments, and the status in real time of all these end users. Make it clear who you should contact right now when you need it most. The multiple communication modalities included in our platform, and that is both text, which is critical, one-to-one text, group text, and broadcast messages, which are one-to-many with a very limited return path, allow you to engage with your needed clients and colleagues immediately. Ultimately, our customers tell us this is what makes them more efficient and returns them from becoming computer operators to high-quality patient care. So a couple of slides with some data on real meaningful impact. And again, we've collected this across our customer base of a significant number of clients. On the left-hand side, we've got a client with 20% faster radiology turnaround time due to the use of our CC&C, Clinical Communication and Collaboration platform. From a clinical response, we have another client that has reduced 9 minutes in the stroke to CT scan time by coordinating the efforts across multiple departments using smartphones and our software. Another facility has seen 15% faster emergency department admissions. Getting a patient admitted and from the ED up into the med-surg floors is a critical key performance index. Taking this a little bit further, on the operational side, we've seen some of the other items above. Reduced length of stay from 4.2 days to 3.8 days. A lot of this is due to being able to discharge a patient more efficiently by communicating better between the team members. Patient satisfaction scores, 86.2% up to 90%, exceeding their goal, personal goal. And this leads to higher reimbursement revenues. And my favorite, an over 50% reduction in the ambient, that's background noise, on patient floors. All the background noise, instead of flowing over the PA system on the floor, goes through the smartphones, all of the announcements. So if you think about this, When you apply clinical communications across the enterprise, you're going to create efficiencies and improvements across many different workflows and patient care KPIs. The enterprise directory built into our product, paired with group texting and calling, make it easy for teams to coordinate and mobilize care, leading to faster turnaround times. We've seen this applied to radiology, as you saw earlier, stroke to CT scan, and faster ED admissions. And one area that I like to spend a few seconds on, not on the slide, is disaster preparedness. Because of the number of clients we have had significant experience in both man-made and natural disasters with our customers. Everything from hurricanes to on-campus shooters. And when that happens, these clients tell us that they value a communication platform that literally everyone in the facility has their hands in. And we've worked with them on creating customized communication workflows to support these emergency responses. So let's do a little bit of real live customer response with a video from one of our clients who's leveraged almost all the capabilities of the mobile heartbeat software.
Freeman is a very typical community health system. We have 3 acute care hospitals, total beds around 400, very fast-paced environment. We do very high volumes, lots and lots of people in our clinics. I was approached by one of our hospitalists about a communication tool between physicians and nurses. We're really just trying to make their job as easy as we can make it. Less time standing at the computer doing things, quicker and more efficient communication between the nurses, physicians, and the other care providers. In the end, we chose Mobile Heartbeat because of the capabilities, the vision that we saw, not only ours, but Mobile Heartbeat's vision as well.
I really like using the app. It's easier to be able to communicate between all of the people on the same medical team.
Before, when we were taking a report from other nurses, it's, well, what extension are you at? I've got Post-its everywhere. Now it's like, well, what is your name? Now I can just look them up because I know that they're on medical or they're on TCU.
We've seen a big difference in the workflow. Now we're able to reach the physicians at a faster pace than before, and we're able to see who exactly is a part of that patient's care team.
If I go into a patient's room and they need to go to the restroom or something like that, then I can just pull up my phone and text that tech that's taking care of that patient.
We tend to make things ours here at Freeman. We have vendor partnerships that we've formed and we do co-development projects. But the thing that attracted us to Mobile Heartbeat specifically was the openness of the platform. What we envisioned right away was, could we implant other products in with the Mobile Heartbeat tools? We very quickly figured out the tech part of it. We have added other applications easily reach from the Mobile Heartbeat platform.
The launch points that we have are very helpful. For instance, the Nova Vigilance and Micromedics.
Our rounding tool is actually on the app, and I don't have to push a cart around, to go into room to room. And I can look up IV compatibility. That's just right there and easy to use.
I really like to be able to look at the labs before I come in or before I go and see the patient. Then I like having access to them if they ask me a question on something I hadn't looked up.
The lab values that we get every morning, if they are not within a normal range, then I get a buzz on my phone to let me know that I need to be looking at something into my patients.
Hey, do you have a good connection on the lead set?
So it not only acts as a backup to my busy schedule, but it also protects the patient safety-wise as well.
It allowed us to give physician tools as part of the Mobile Heartbeat, nursing tools. Mobile Heartbeat supported us in our efforts to do that, and it's resulted in us having a tool that served a lot of folks, but yet was personalized toward the audience as well.
Communication is everything. So much better than what we had before.
I think it's cut down on a lot of the communication errors that will take place during the day.
I don't have to call up the operator and say, hey, I need to call a code at this phone. I can do it from my phone, and everyone's going to be in contact of what's going on without having a lag.
I have everything right here. I can look at my patients. I can look at labs if I need to. I think our time management is going to be way better now.
We're all extremely happy with the Mobile Heartbeat, the selection, the implementation, and I think it will ultimately result in better patient care because they can spend more time with the patients.
Thank you. That's just one great example of a client who's driving better patient care and efficiency through CC&C, clinical communication and collaboration. All right, now on to the meat of this webinar, and this is our novel use cases for novel COVID-19. And we've picked these up by working with our clients and learning how they've applied communication software to real issues that they faced during and currently face during the pandemic. We're going to put these in 4 different categories: broadcasting new procedures, mental health and helping their staff through mental health issues via better communication, proper and more timely training, and clearly and timely communications. Our end users are using the platform for general communication regarding COVID as they go about their day in treating the pandemic. And what I find particularly interesting in this group is how we've seen our customers leverage these communication capabilities to really do some great things for their staff beyond the common. We've been inspired in what we've seen on this front. We're going to share this couple real examples in a second. And it makes a lot of sense when you've got a communication platform in the hands of every staff member, not just in the hands of nurses or doctors. It becomes a powerful way to engage your entire employee staff, know that their organization has their backs during a really tough time. And we've seen this play out as follows. We've seen broadcasts being sent to large groups. We've seen mental health resources being deployed. We've seen quick access to proper training. And finally, we've seen large-scale communications, as well as specialty roles created just around the COVID pandemic. So let's dive into this. First up is a great example of one of our clients, and that is broadcasting PPE updates on what's going on throughout the facility. Broadcast messages are a mightily beloved feature within our product MHCure. This is a text-based capability that allows one user to send out a message to a predefined group of users. It could be a group by role, it could be everyone in a hospital, or an entire staff of a division of facilities. All of those users who receive the message can respond independently back to the sender, but it doesn't throw everybody into a group chat. So we're not overwhelming folks with a broadcast message that turns into spam. We see this feature used frequently in the event of a code. We've seen it used for dangerous patient situations, and there's a ton of flexibility to it. A predefined recipient group could be a couple users, or as I said earlier, everyone in the entire facility. During COVID, we've seen some of our customers put this into effect for the purpose of sharing timely updates around departments or units with regard to PPE. In this case above, if we walk through the screens, it's an update on a change procedure around the use of N95 masks. If people have questions, they can text back to the sender. But again, those replies don't turn into a massive text thread for everybody. The next example, and I'll just walk through the different slides here, you can see that happening. The next example is enabling counseling easy access. And this example here and the one that follows is going to showcase what we refer to as the inter-app functionality of our platform. Inter-app means that our clients can customize the user interface of our product on their own for different roles, different facilities. And many of our customers use this for providing quick access to other apps on the smartphone, like reference apps, medical information apps, or even real-time language interpreter applications. But it can also be used simply to launch a website or to make a call. So in this case, we had a customer configure this inter-app launching called a launch point, so it would be easy for staff members to make a call to an anonymous counseling hotline. Or if they didn't want to talk on the phone, they could launch to an internal counseling website to help them in times of stress. You can see here the launch point and going out immediately to the hotline directly from our product. And I will add again that our client made this modification to the product on their own. It didn't require us to be involved. They were able to do this 100%. Along those same lines of these launch points is to help enable easy access to training. And this was to provide quick access to videos and training materials around PPE. So we know PPE is a highly valued resource during the COVID pandemic, and it's essential that your entire staff knows how to use it correctly. As new variations of PPE were arriving, it was essential that everyone understood how to use the latest and greatest. So in this case, instead of the counseling link, our customers added a link to watch a training video for donning and doffing PPE. There's the training video link highlighted. Clicking on it brought up immediate access to the training video in another application. All right. Clearly identified COVID-related roles. What do I mean by this? Well, this is a bit of a learning we've had with other clients in other types of disaster situations, and COVID-19 pandemic is certainly one of those. We've been through active shooters on campus, earthquakes, floods, fires. In each of those situations, our customers have activated a virtual incident command center within our product. This virtual command center is available only to a specific groups of roles: emergency coordinators, hospital leadership, external communications, and sometimes others. And what it provides is it gives them a central place to coordinate and then communicate to the broader staff population. So in the case of the COVID-19 pandemic, this was no different. But COVID did not stop, so new roles began to show up within our customers' environment. We saw PPE coordinators, for example. We saw special COVID task force roles. And what's powerful is that with these roles, when you have a question to go to one of these staff members, I can quickly type in PPE, searching in my contact directly, and there you go. The PPE coordinator is shown up immediately for my unit. So making it clear who to reach out to and giving staff a method to actually connect to get answers or report problems is critical in times of a crisis. My favorite, and this is one of the great uses of a communication tool that reaches your entire team, is the ability for some of our clients to send notifications to every facility at once that you might not think about. And my favorite on this one is some messages of solidarity and support to staff who have been on the front lines for long periods of time. It's enabled the hospital to encourage their teams to make use of the mental health resources available. And it's also been able to give employees easy access to help and resources and counseling at the toughest time they faced in many, many years. So I'm going to close our discussion with a little bit of a story about one of the early big hotbed facilities, and then move on to questions in a second. And this was in Queens, New York City. It's a hospital, it's a client of ours that was hit extremely hard early on in March and April with COVID patients. When we did a debrief with them recently, one of the things that they came up with is they love the dynamic capacity inside of Mobile Heartbeat. They were putting beds in cafeterias and in creating ICUs and operating theaters because they were surging with new patients. And we helped them because of the dynamic nature of our product. It made things much easier to find because we build the product around the concept of patients. They also saw a lot of what's known as on-demand staffing, where brand new people were coming in more or less in a wartime environment in a healthcare scenario that was changing on a minute-by-minute basis. And because of our concept of dynamic roles, in other words, you can communicate with someone knowing their role. You don't need to know them by name. It made these new temporary staff effective immediately. But what was most telling was when we interviewed them after the pandemic began to recede, the contrast between their facilities that had our clinical communication software, MHCure, versus those that did not. It was a remarkable and very stark difference. I appreciate your time today listening to our experience and some of the hints and tips from the real world of treating patients during the COVID-19 pandemic. And at this point, I'd like to open up to the floor and to those on the line for any questions that you might have. And again, thank you.